to accumulate more of the drugs, resulting in more of the side effects. And that was a concern not only for the family, but as a part of the decision-making team, I was also very much concerned about the same. She had an advanced breast cancer. This is the win of science. We are able to tackle even at the age of 87. And that's why that patient's daughter is with us today. Hello friends. Today we are here to talk about role of oncology in geriatric population. So geriatrics is something which actually deals with population above 60 or 70. Oncology is a branch which deals with cancer. So when we talk about cancer in elderly, it becomes geriatric oncology. Geriatric oncology is something different from the routine oncology because the body and the way the drugs act, they are absolutely different from the routine oncology patients in geriatric patients. The reason is because of the different kind of fat distribution and the different type of metabolism mechanisms they have in their body. As we all know, with the advancing age, the metabolism becomes slow and the body has a tendency to accumulate more of the drugs, resulting in more of the side effects. That's where it becomes very important to understand that in geriatric population, one has to make sure that we are giving the doses which are compatible with their age. Today, we are talking about one of the octogenarian patient who was almost 86, 87 at the age when we started her on treatment. She had an advanced breast cancer, which was troubling her with her neck movements. To our surprise, the primary site was absolutely free, which was operated almost 5 years back. And when we decided on to treat her, we planned a biopsy for her. God's grace, everything went well. But there was a phenomena with the name of reversion of receptors, which happened for her. And she had a change in receptor status. She was found to be HER2 positive and hormone receptor negative. Now, this was not the scenario initially. There was a great confusion because the family was a bit hesitant in starting any kind of chemotherapy for her, and which is a very genuine concern for a family which is very much well connected and well knitted. And that was a concern not only for the family, but as a part of the decision-making team, I was also very much concerned about the same. But still, we took the decision and we started her on one of the latest treatments available, that is the subcutaneous injection of trastuzumab with pertuzumab in the name of Phesgo, along with very low dose of chemotherapy. We had to face certain amount of difficulties in that scenario, but those were well tackled with the help of various supportive methods and by changing the course of treatment as per the clinical need. Today, after almost 8 to 9 doses of chemotherapy and few doses of targeted therapy, we have been able to achieve almost a near complete resolution of the disease in her. So this is not my win. This is the win of science, where now with very minimal side effects, we are able to tackle diseases like cancer even at the age of 87, which is wonderful because that gives you a boost that yes, tomorrow we'll be able to treat a lot of patients with minimum side effects. So that's how science is progressing, that's how oncology is progressing. And that's why that patient's daughter is with us today to tell her experience about her cancer treatment in Geneses Hospital with us. So let's listen to her and understand what was their experience.
Hello, My name is Mrs. Bajaj and I am daughter of Mrs. Pushpa Keswani, who has been suffering from cancer. Actually, we didn't realize that she had cancer till the time Dr. Suhas checked on her. She had been suffering from a lot of neck pain issues, and then we started observing some time back that her shoulders had swelled up. Then we got a little concerned and got lots of tests done, after which we were told that she had confirmed cancer of 4th stage. Now the problem was she is 87 years old and we were not sure what to do. We were told about Dr. Suhas by Dr. Nirula, and as soon as we came and saw him and met him, we were convinced that we have reached the right person, and we just did not want to take any other opinions except follow what his regime was going to be. He thought and decided on a very good therapy for her, strategically trying to take care of all the issues that were coming up. We started with her chemo, and as again I would like to say that she is 87 years old and we were not sure, but Dr. Suhas did a great job. Now after the chemotherapy sessions, along with that he also started with a new treatment called Fesgo, and that also suited my mother very much. Now her cancer is totally resolved and she will continue with the Fesgo injections for a year, which is after every 21 days. She's already coming back to normal and feeling very good. All of us are so happy with Dr. Suhas's treatment, and I would appeal to everyone that age is no bar. Whether you are 60, 40, 80, 90, any age, it can be tackled, and you must come to Dr. Suhas. It's surprising, everybody runs to metropolitan cities for cancer treatment. You don't need to do that because it's very well available here with Dr. Suhas, who is extremely talented and he is a wonderful doctor and his treatment is just perfect. We are extremely happy with his work. Thank you.